Hello, Betty. My name is Madison, and I'm the student nurse taking care of you today. I'm washing my hands as I'm saying this. Can you tell me your name and date of birth?
My name is Betty Jones. My date of birth is 5/21/52.
Perfect. That matches your wristband and the MAR. I already washed my hands. I gathered my supplies, and I introduced myself. And now I'm going to explain the procedure. And I provided privacy. Alright, so today, the doctor has ordered a unit of packed red blood cells to be transfused. Are you familiar with the process?
Yes.
Okay. Are you familiar with the transfusion reaction that can occur?
Yes.
Okay. I'll just review some of the signs and symptoms we're watching for, such as itching, hives, back pain, chest pain, headache, trouble breathing, nausea, or just anything that feels off. So let us know if you experience any of these. We'll be in there for the first 15 minutes of the transfusion and then checking on you periodically after that. I have a signed consent form for you that we need you to sign before we begin the procedure.
Okay.
So she signs the consent form. Perfect. And I see that the red blood cells are also on your MAR for today at this time. So I'm going to get set up while my fellow nurse goes to the blood bank. So I have normal saline, which is the only solution that's compatible with blood. It's not expired, there's no abnormalities. And again, I check compatibility. And then I have the blood transfusion set, IV tubing, that I'm going to use. So now I'm going to prime this tubing line so that when the red blood cells come through, they have a nice cushion to land on so that they don't lyse. There we go, it was a little tangled. So now that my tubing is primed, I'm all set up for the blood over there. Next I'm going to check the patency and compatibility of the IV catheter itself. So I see that it's pink, indicating it's a 20 gauge, and generally you want between an 18 and 22 for blood transfusions, so this one's perfect. And now I'm going to check the patency using a saline flush according to company policy. Betty, let me know if you experience any discomfort, okay?
Okay.
Perfect. Okay. And then I'm feeling for any signs of infiltration, any pooling, anything like that. And I'm not feeling anything like that. Betty, any discomfort?
Nope.
Perfect. So I know that this line is patent and I can use it for the blood transfusion. And lastly, I need to check her heart and respiratory and other vitals, just so that I'm aware of any possible indication that she could have fluid overload that could contribute to transfusion reactions, complications. So I'm just going to listen to her heart. It's good. And I'll listen to her lung sounds. And I'll take her blood pressure, temperature, and other vital signs. And I'll also be taking it after 15 minutes of the transfusion starting, and then every 15 to 30 minutes for the duration of the transfusion itself. So now that I have my IV ready and the tubing, and I know she's safe to receive it, I'm going to wait for my nurse to bring the blood, and there she is. Hello, hi. Thank you. Alright, so I have Betty Jones, 5/21/1952.
Betty Jones. 5/21/1952. Sorry.
You're good. And I have Madrock 224466.
224466.
And I have account number 123456.
123456.
And I have red armband 456654.
456654.
It's B positive blood.
B positive.
7890 donor pool.
7890.
4 units in the pool.
4 units.
250 milliliters of packed red blood cells.
250 milliliters of packed red blood cells.
It expires 6/25/2021 200 or 2000.
6/25 of 2021.
And the donor was O positive.
Donor is O positive.
And a compatibility test was completed.
Compatibility test was completed.
And ascension number 1.
Ascension number 1.
Okay, perfect. And then if you could just sign on the sheet. Perfect, thanks.
Mm-hmm.
Alright, and then I already confirmed that this matched, but I'll check again against the MAR as well. So again, I have Betty Jones, and her birthday is 5/21/1952. It is 1/27/21 at 1400, and I have 1 unit of packed red blood cells. I have Betty Jones, 1/27/21, and it's 1400, 1 unit of packed red blood cells. Betty Jones, 1/27/21, and 1 unit of red blood cells, 1400. And she's not allergic to this. And then before I start touching the blood, I'm going to put gloves on. Safety first. It's a little weird to put gloves over close. Alright, Betty, do you have any questions before I get started?
When's dinner?
Dinner is at 6:30 p.m. tonight, and we're having meatloaf.
Awesome. Splendid.
Splendid. Okay, I have the blood, and I'm going to hang it, again, with the normal saline. I checked it, and there's no gas or bubbles or abnormal coloration, and it is not expired. So we're good to go. Now I'm going to spike it. Right, and now I'm going to make sure that the blood goes all the way to the end of the tube so that the bag is able to be emptied by the time I have to remove it. I have 30 minutes from the time I get the bag to put it into the patient, and 4 hours of the bag can actually sit and run. So I'm going to do that. Okay, and then the blood just reached the end of the tube, so I know that it was ready. Okay. And now I'm going to connect her up. And normally there's a cap on here, so I take that off and connect it. It's not locked. I verified the rate earlier tomorrow at 15 milliliters per hour, and I'm going to infuse the entire 250 milliliters in the bag. So I have the 50 milliliters per hour and 250 to be infused. And then I'm going to open up my clip. And then for the next 15 minutes, I'll stay in the room and watch for transfusion reactions, any signs or symptoms, and check her vital signs every 15-30 minutes. And a couple changes that could be made if the doctor ordered it or the policy and the company dictated it. I could use a blood bag warmer. Depending on the patient, this patient didn't require it. And if there was a blood transfusion reaction, I would stop the transfusion and contact the lab and medical professional, staying with the patient to make sure they're safe. And if the transfusion goes all well, then I would stop it, make sure all the blood goes through by pushing normal saline so that the patient gets all the blood, and then disconnect, throw everything away, and wash my hands, make sure they're safe, and I document start and stop time of the infusion, the amount of blood in the infusion, the type, so like B positive, record number, donor number, blood bank number, and then also the IV site, the type of gauge that it was used, and how the patient tolerated it, and any other pertinent information that I deemed noteworthy. And then after 15 minutes, I would take my gloves off, wash my hands, and lower the bed, give her a call light, and good to go.